Hello everyone, a very warm good evening to everybody. I hope you are enjoying the clinical grand rounds. So for the students who have joined us just now, who might not be aware that we are doing a weekly clinical grand round on the eMedicos app, and also keep in mind that there is also a weekly integrated round being done on the app every week. So I hope you are following up both the rounds, both the integrated as well as the clinical grand rounds. And I'm also sure that most of you who are regular course students who would also be aware of the new curriculum that we have launched now. In the coming year, in the coming month, the entire of the DAMS regular course and the ultimate live course will now be run in an integrated curriculum. When I say integrated curriculum, it means that when you do respiratory medicine, at the same sequence you will do respiratory physiology and respiratory radiology or chest X-ray imaging, so that you are able to understand better. You will be able to do orthopedics and orthopedic radiology, orthopedic pathology together. So we are creating that paradigm shift. And today, in my today's session, I'll talk about a very contemporary topic. I wanted to do it, even for the upcoming INI-CET exam. So this video will also be shared in the AIIMS capsule. So the key here is that we are all hearing about the radiological findings in COVID-19 pneumonia. And I have in my multiple videos in the past talked about the ground glass opacities that you see in the COVID pneumonia, which are more peripheral, basal predominant. We also talked about the possibility of having crazy paving and the reverse halo appearance in the COVID pneumonias. Now, what we today will do is we'll talk about mucormycosis. Because of we have seen in the last few months that once with the COVID wave, after the the use of steroids, and not only steroids, also with people with uncontrolled diabetes, we have seen a huge number of cases of mucormycosis. So how would you identify this on radiology is going to be my topic for today. I will talk about both about the sinonasal mucormycosis, as well as I will also talk about the pulmonary mucormycosis, the radiological findings, and I feel there might be a question about this in your upcoming exams as well. So let's understand it further. So I'm sure you all know this by now that like mucor is one of the ubiquitous fungi, and in immunocompromised people or diabetics or people with who are on steroids, this fungal spores can invade the nasal mucosa, and it has angioinvasive nature, so it leads to infarction of the involved tissue. So keep in mind, this fungus is angioinvasive and it will lead to infarction of the involved tissue. This is of critical importance for one of the radiological signs that I will be teaching you today, which is my pick for the question in this upcoming exam, I'll tell you. But remember, the tissue can get infarcted because of this fungal infection. That is very important to remember here. Now, second thing we need to know is this is how a coronal CT scan of the sinus looks like. Okay. So this is how a NCCT PNS looks like. You must have seen this in your exams as well. I'll just show you a bit of anatomy here. These are your maxillary sinuses, maxillary antrum. This one is your inferior turbinate, middle turbinate. Now, this is a normal CT, but the reason I'm showing you these multicolored arrows here is because I want you to see the problem with mucor is because it is angioinvasive, it invades the blood vessel, it invades the surrounding tissue. From sinus, it can go into the orbit, or from the medial wall, it can go into the orbit. You know, the medial wall is the thin wall, so the infection can go into the orbit. So you may have orbital cellulitis, you can have optic neuritis because of this, or you can have intracranial involvement or intracerebral invasion, which can lead to cerebritis, brain abscess formation, and even it can go to the cavernous sinus, leading to cavernous sinus thrombosis or vascular thrombosis and vascular complications as well. So the important thing here in mucormycosis is, and you might have seen that from the sinus it can go to the subcutaneous tissue, and you can have, so the important thing here is invasion. So this it can lead to so it is rhino nasal, okay, so it is involving the nose, sinus, Okay, sino-nasal, and it can involve the orbit and the brain, cerebral. So that is the challenge here, that it can be invasive. It can go into the orbit, it can go into the brain. Okay, so that is why it is so important to understand. Now let's understand what will you see on a CT scan if you have mucormycosis. Number one, you can see the sinus which is involved will be opacified with soft tissue. Not only that, you will see evidence of infiltration into the perientral tissues, and you can see bone erosions as well. Okay, so let's see and understand. Now I want all of you now to look at the screen for the first CT image where we are looking at mucormycosis. Look at the right sided sinus is normal. This is air. Air is black on a CT, so that sinus is normal. That is a normal pneumatized maxillary sinus. I want you to look at this sinus on the left side. What do you see? It is opacified. Okay, but how do you know, looking at just one image, that this is not just sinusitis? Why mucor? One of the reasons here is, look at the dark area around the normal maxillary antrum. Can you see that is the normal fat plane? On the involved area, the perientral fat is infiltrated. You don't see that fat. And I also want you to look at the subcutaneous tissue. Look at the subcutaneous fat on the normal side and look at the subcutaneous fat on the abnormal side. Can you see how it is not just the sinus, there is subcutaneous infiltration, there is perientral infiltration. So when you see sinus opacification, especially in today's pandemic, with loss of perientral fat plane or infiltration, with infiltration into the soft tissues, you start thinking about mucormycosis. Everybody clear? Okay. So let's see one more example. Now again, let's look at one more example of how mucormycosis would look like. I want you to see the normal sinus, totally air filled, no soft tissue. On the abnormal side, you will see there is nodular thickening. Can you see that is the soft tissue? It is not completely opacified, but there is nodular thickening. But again, if you notice, adjacent to the sinus, there is no fat plane, there is no, so it is that clear, that there is clear evidence of perientral infiltration. So what is the first point I taught you? That in patients with mucormycosis, if you're suspecting it, especially if somebody is on high dose steroids or a diabetic, if you see sinus opacification or mucosal thickening along with infiltration into the perientral tissues, you think about mucor. That is the first thing I want you to know. Everybody clear? Okay. Do let me know if you are clear. Okay. Okay. So let's see the next picture now. Second thing to remember is when we look at the MRI, and MRI has more value in this infection because it helps us to see the orbital involvement as well as the cerebral involvement. Now the fungal elements, now if it is any sinusitis, there will be fluid in the sinus, and the fluid in the sinus will be hyper intense. It will be bright on T2 weighted image. But remember, in fungal infections, the fungal elements lead to T2 hypo-intense appearance. That means the sinus will not only be, usual in sinusitis, the sinus will be bright. It will be white on a T2 weighted image because of fluid. Here you will see, because of fungal elements, you will find dark areas. So fungal elements will lead to hypo-intense signal on T2 weighted image. I will show you. Okay. So now see, this is a T2 weighted MRI image. Okay. So how do I know T2 weighted? Because the CSF is white. This is your fourth ventricle where you can see the CSF is white. This is the brainstem, the cerebellum. Okay. This is one maxillary sinus, the other maxillary sinus. On the side where I have marked an arrow, can you see inside the sinus there is not only fluid, there are some dark dots. That is because of the fungal elements. So because of the fungal elements, are you clear that in fungal sinusitis, you will always have some hypo-intense signal on T2 weighted image? If that is mentioned in the question, they are trying to point towards a fungal etiology. Okay? Clear? Great. Okay. Now, so once you are clear, I'll show you one more thing. Now, this is the sign which is, catching a lot of attention today, and I think it might be asked as a question in your exams as well. The sign that you need to remember is the nasal turbinates on a contrast enhanced MRI in mucormycosis may appear dark. So we call it black turbinate sign. The reason is what I told you in the beginning of the class itself. So when I give contrast, IV contrast, So the normal mucosa on the turbinates would enhance, it would take up the dye. But if you remember in the beginning of the class I told you that mucor is angioinvasive. Because mucor is angioinvasive, it leads to, tell me, anybody? Infarction. So the dead tissue, the necrosed gangrenous tissue will not take up the dye. So you'll see the turbinate will appear dark. I will show you a classic picture. This picture has been asked in multiple quizzes, and I think it can be asked in your exam as well. So I will just, showcase to you what you look at the inferior turbinate. Can you see the mucosa overlying the turbinate is white because it is taking up the dye. It is a contrast enhanced MRI. It is a contrast enhanced MRI. Okay. But look at the mucosal thickening in the maxillary sinus. Can you see there are dark areas and the area of the turbinate here? This is all dark. It is not taking up the dye. The mucosa should have lit up with the dye. When you give IV contrast, it should enhance. But because this is gangrenous, dead, infarcted tissue, it is not enhancing. That is what is called as the black turbinate sign. So in today's era, it has, we've seen a lot of, news around this sign. I think this is the potential MCQ. This, if you wanted to know one thing or two things about mucor, one is that I would always prefer a contrast enhanced MRI over CT here because of the involvement of the orbit and possible risk of, I want to look at the brain, I want to look at the cavernous sinus. So I will do a contrast enhanced MRI. So I hope this answers your question that some of you were asking. And second is dark turbinate sign on contrast enhanced MR is seen in mucormycosis. Okay. So I have already talked about this. I am again going to repeat it, that MRI helps you to also look at the cerebral extension in mucormycosis. How does that look like? Okay, let's see here. So I want you to look at this coronal T2 weighted MR image. You will see there is some sinus opacification here, some sinus opacification here. But look at this. There is edema in the brain. Can you see? There is area of vasogenic edema in the brain that tells us that there is invasion into the brain. There is some cerebritis there. And cerebritis is the initial inflammatory phase that happens, and it may progress even to an abscess formation. I will show you how an abscess would look like. Now again, see another example of mucormycosis where you have sinus opacification here. You can see there is sinus is opacified. Not only that, you also see a ring enhancing lesion in the temporal lobe. This is how an abscess would look like. A brain abscess would be ring enhancing, but also remember brain abscess, because of pus inside, will appear bright on diffusion weighted MRI. With this image, I'm sure we have rest that entire doubt in peace that, what is better for mucus, CT, PNS or MRI. MRI is better because we can, on MRI, we are able to see the extension into the brain and the orbit, which is more important to see here. And I'll show you another example. Now, there can be orbital involvement here. How would it look like? I'll just show you an example here. Look at this opacified maxillary sinus on the CT. But can you see soft tissue appears to extend into the orbit? Can you see this is the inferior rectus here, and it is extending, kind of encasing it. So there is soft tissue getting involved in the orbit. So you can have orbital cellulitis complicating mucormycosis. So we, as a radiologist, what we are actually looking for is involvement of the surrounding structures. We are trying to look for sinus involvement here and orbital involvement here. Another example of a patient, you can again see all the ethmoid sinuses here are full of soft tissue. And you can see there is soft tissue in the orbit, especially in the area of the orbital apex. That is how orbital involvement would look like. And, I thought I'll give you an answer here, which has been asked even in your exams in the past as well. I just want you to look at the optic nerve on this side. There is enhancement of the optic nerve here in the contrast enhanced MRI. This is a post-contrast fat suppressed T1 weighted MRI of the orbit, where we see enhancement of the optic nerve. So you can have, so you can have orbital involvement, you can have cellulitis, optic neuritis like you see here because of the invasion of the fungus into the orbit. So this is how optic neuritis looks like, and you might have seen a question in the past in the exams. Investigation of choice for optic neuritis is contrast enhanced MRI. Okay, are you clear? Okay, but do not forget mucormycosis can also lead to cavernous sinus and vascular involvement. So let me show you how it really looks like. So this is the, you can see there is enhancing soft tissue here in the sinus. Okay, this is the normally enhancing cavernous sinus. On the involved side, the cavernous sinus looks bulky, as well as there are filling defects. So there is a cavernous sinus. Thrombosis here, and you can even see there is orbital apex involvement here. So this is how the normal side is. This orbital apex is involved, the cavernous sinus is involved, the sinus is ethmoid sinuses, and the nasal cavity is filled. So that is one of the important things to look out for on a MRI when we are looking at a patient with mucormycosis. And you can even have vascular thrombosis complicating it. So this is a MR angiogram. This is the internal carotid artery of one side. This is the basilar artery. The other side is all thrombosed. So the disease can involve the cavernous sinus, can also involve the internal carotid artery, and can lead to internal carotid artery thrombosis as well, which is what we see here. So why is mucormycosis so dreaded is because of the complications. It can involve the orbit, it can involve the cerebrum, brain, it can lead to abscess, it can lead to cerebritis, it can lead to vascular complications, it can lead to cavernous sinus thrombosis. So this is the overview I wanted you to look at, and the broad 2-3 messages that I wanted you to have is MRI is better than CT because we can look for cerebral as well as orbital involvement. And I told you the rationale and logic behind the black turbinate sign. Why do you have a black turbinate sign in mucormycosis? It is because the fungus is angioinvasive, and the fungus leads to infarction and the gangrene of the tissue, and it does not take up the dye, and it remains dark on a contrast enhanced MRI. Are you clear, everybody? Okay. Now I also wanted to add a line here that you can even have pulmonary mucormycosis, and now it is again catching fancy of the examiners that what all can you see if you have mucormycosis involving the lungs. Usually what we see in mucormycosis is the typical findings that you see in fungal infection in the lungs would usually be halo sign and reverse halo sign. Reversed halo sign is more important here. So if you want to remember one line, that reversed halo sign is more important for pulmonary mucormycosis. It is also seen in cryptogenic organizing pneumonia. But remember, the peripheral capsule that you see in mucormycosis in reverse halo is more thicker. I'll show you how it looks like as compared to cryptogenic organizing pneumonia, where it is more thinner. Okay, let's see. Okay, so for those of you who don't understand, I'll show you what do we mean by halo sign and what do we mean by reversed halo sign. Halo sign means a central consolidation surrounded by peripheral ground glass opacity. So you see a nodule surrounded by ground glass opacity, that is the halo sign. And that is what you might have, if you have studied with me in the past, I have explained it to you in the invasive aspergillosis topic that we were discussing in our classes in the past. Now see, this is the central ground glass and peripheral consolidation. So this is the reversed halo sign. So you see ground glass opacity surrounded by consolidation. So both of these are possible in mucormycosis, but reversed halo sign is more typical. I'll tell you the key words to remember here. So the role of radiology here is to point out or what radiological findings are more in favor of pulmonary mucormycosis versus pulmonary invasive aspergillosis. Let's try to understand. I'll show you. Please see. This is what is the reversed halo sign. The central ground glass and a thick peripheral consolidation, which is more nodular, more irregular as compared to what we see in cryptogenic organizing pneumonia. So let's keep in mind these few lines. Features which are favoring mucormycosis, pulmonary mucormycosis on a CT are reversed halo sign, okay, presence of a solitary lesion, presence of pleural effusion, presence of sinusitis. Okay. So reversed halo sign is more common in mucormycosis versus invasive aspergillosis. Presence of pleural effusion, presence of sinusitis points towards mucormycosis. And if there is an infection development despite voriconazole, again you think about mucormycosis more than invasive aspergillosis. Airway invasion favors invasive aspergillosis. If you see airway invasion, that favors invasive aspergillosis. So we need to differentiate between the two usual culprits, but because the antifungal required for both of them would be different. So radiology helps in a way if you see pleural effusion, if you have sinusitis, if you see reverse halo sign, these are a diabetic patient or or patient on steroids, these are pointers towards mucormycosis. Okay, are you clear, everybody? Okay. And before we conclude today's session, I thought I'll give you some message so that you go home with a more positive mindset. I want you to believe that you have a life where you have a purpose which is larger than what you believe it to right now, and I believe that you have a destined path to fulfill. You have a personal legend to fulfill. So what happens is when you are at your age, sometimes you start, feeling that, maybe you are deprived of something. Some people are watching TV, some people are, just watching web series, and you are here in the middle of the, session studying on e-medicos with us, and you're studying with lectures. So sometimes you might feel a little distraught. I just wanted you to know that, in life, I think the most important thing is to not to have regrets later on. And to reach to that stage, you need to say the words that you want to do, and you need to fulfill the dreams that you want to fulfill. You don't want to, in today's world, if anything that we have learned in the last 2-3 months or 2 years is we have learned how fragile human life is. And you don't want to leave this planet by, with words inside you, with songs inside you, with dreams inside you. You want them to be fulfilled before you go. So nobody at the end of life would regret not watching Mirzapur or not watching any web series. But you would really regret if you don't, tell your loved ones what you really feel about them, and if you are not standing with your family when they need you. These are the things you would regret, and you more likely you will regret the dreams that you did not go after. So what I wanted to leave you today with is that, keep in mind, this is what my fear in life always has been, and my fear is that I want to do things that I really want to do. I don't want to leave them undone. I want to do them, and they may work out, they may not work out. Just like this clinical grand rounds was one of the ideas that I wanted to do. I want to bring it to light. I want to connect to students. I want to make sure that we are able to reach to you and touch your life. Maybe you learn one thing. Tomorrow you're reporting an MRI as a radiologist. You find a dark turbinate, and you remember Dr. Sumay told you once, and that is something that would make lot of create a lot of value for me. If I am able to make a difference in your life, that creates value in my life as well. So I don't want to go from this planet without saying the words that I want to say, and that is why I would write down things. I would write on my blogs, I would write on Instagram. If there's something in my heart, I want to say it out. If there are dreams, there are ideas that I have, I want to make sure that they see the light of the day, and that is what I want to inspire you with today. I only wanted to tell you today is, I want you to, keep this in mind. If you can, make it as a hashtag in the group and write what you really don't want to regret later on. I'll try my best to reply as well. The most important thing is, when you will look back at life, when you are 80 years old, 90 years old, 100 years old, 110 years old, when you will look back at life, the only thing you would regret is if you don't go after your dreams today, if you don't say the words that you want to say to people or, to your own self. Those are the things that you would regret. Nobody regrets missing on a web series. कोई क्रिकेट मैच मिस हो गया, कोई वेब सीरीज मिस हो गया, उसको कोई नहीं सोचता 110 साल के होने के बाद आप ये सब नहीं देखोगे. What really matters is that you should have no regrets when you reach that stage. And whatever time you're investing today in your studies, and whatever time you're investing in your studies in the last 3-4 years, 5 years, this would all form a foundation for the dreams that you will fulfill in your entire life. This will give you the direction. So keep working hard, keep dreaming big, and if you have something to say, speak it out. If you want to express gratitude to your family, to your parents, do that. It's like you don't want to let words which were inside you but you never spoke, dreams which were inside you but you never pursued them. You don't want to become that kind of person. I wish you all the best. It is my honor and my pleasure to be able to touch your life today and to be able to enlighten you on a small topic. I wish you all the best. God bless you, and I look forward to meeting you and connecting to you in various classes. I just want again to tell the students who are with us this year that in the next cycle, the ultimate live course will become integrated live course, and that would happen in another month. And even the VSAT regular, face-to-face regular will become integrated. The entire curriculum will be in a way that you dreamed of. My entire vision here is that this is something that I really wanted to do for so long, and I'm so happy that I'm able to implement that. When you will study cardiology in DAMS, next day you will learn cardiac anatomy, then you will learn cardiac physiology, then cardiac radiology. Everything will beautifully connect in your mind as concepts. I wish you all the best. It is such a pleasure to be able to connect to you, all of you. Good night, take care, and say thank you to your parents. God bless you.